Hello and welcome everybody. Happy Tuesday. As I was getting ready this morning, I was talking with my 3-year-old and she always asks, Mom, what day is today? And I said, it's Tuesday. And she goes, oh, Taco Tuesday. I was like, yes, it's Taco Tuesday. I have raised you right. We're full steam ahead today with Taco Tuesday. Very excited to have Kelly Rayburn here with me. She is the Assistant Vice President of Sales and Distribution at Medico Insurance Company. We've added Medico to our e-app. It is something that we have been working on for a while. We're very excited to have Medico on the platform. I know insurance agents are already using the CSG tool to submit their applications, so we can already see that engagement. So agents I know are also very excited. So in today's webinar, we're going to kind of cover two fronts here. We're going to talk about the Medico product, the Med Supp. I'm going to let Kelly go through some of that product training with you. And then after Kelly is done, we're going to get right into the e-app demo. So we're going to show you how you can quote Medico on CSG, couple different ways in which you can access our platform. We're also going to go through the e-application start to finish. So I'm going to take you through a full application. And then we'll do 2 different signatures because we do have 3 different signature options available to you on the platform. So I'm going to demo 2 of them, the in-person and then the email signature option. There's also a text. And the good thing about seeing a demo of the email is that the screens are the exact same. It's just that initial verification code and link go to a smartphone instead of an email address. So a couple of questions before we get started. We just like to gauge the agents that we have on today's training. I know there are several of you signed in here. So first question here, if you are currently contracted with Medico, yes or no? Just simple question. For those of you that are not contracted, I always do recommend you connecting with your Integrity FMO to get contracted. If you're not sure who that FMO is, we can absolutely connect you with that FMO or refer you to one if you do not already currently have an Integrity FMO. So just currently, are you currently contracted with Medico? 91% of you are saying yes, that's awesome. That means you can get in there today and start submitting your Medico supplement applications. If you are not contracted with Medico, once you get contracted, it does take just a 24-hour update, and then you can use our system to submit those applications. So it's awesome. So many of you are already contracted with Medico. That means you are good to submit applications on our system. One last question here. Just curious to know how many of you have used CSG e-applications before. We do have other carriers on the platform. We're really trying to be your one-stop shop for you to quote and do enrollments. So every carrier application is going to look the same for you. Again, we're going over Medico's e-app today, but just curious to know how many of you currently use CSG to submit your e-apps. I guarantee you after today's webinar, you will feel confident submitting your applications on CSG. It's so easy to use, very user-friendly, easy to navigate through, saves everything for you, and it's really one simple process. So that is my goal at the end of this training, is for you to feel confident submitting your applications. If you ever have questions when you're submitting them, we're here to help you too. So you're never alone in that process. Looks like 30% of you have, the other half has not. So again, we'll get you all up to speed on that. So I'm going to hand it over to Kelly here. I'm going to let her go through her Medico product training with you, and then we will get right into our e-app demo following that. So Kelly, let me just switch over the reins to you. I will also say, as I'm making Kelly the presenter, we are recording today's webinar, so you can always re-watch it following the presentation. The system will automatically email that out to you. If you have any questions as I'm going through today's training, feel free to type those questions into the questions box. If they are product related, I will ask Kelly those particular questions, but we will get to questions at the end as well. So Kelly, go ahead, take it away.
So I should be showing my screen right now. Can you see it? It doesn't show me that you can see it.
I can't yet. Let me see. Let me do one thing here. says that you have control. Let me take control over and we'll try one more time here. And I will try this one more time.
Okay, well, that's weird. Okay, so you know what? I can wing it. No problem. I can wing it. Since 90% of you are already with Medico, let's just wing it, right? You're gonna kind of know. I'll tell you what, this is where the rubber meets the road for the attendees. This is where note taking is very important. So let's just kind of go forward. So with Medico, why would you want to choose Medico? Well, we're a very strong and stable company. AM Best ranks us as an A, excellent. We've been selling in the insurance field since 1930. So we've been in the insurance market for almost 100 years. And we have an extremely unique way of approaching business. We actually look to the field to be able to give us feedback so that we can put the right products out in market the way that you want to be able to present them to your client. That's the reason why we opened up the Medico charter, or the Medico Med Supp charter that we opened a little over 18 months ago. It's the reason why we've made some of the changes to our other ancillary products that we have in our product suite. So we also want to make it as easy as possible to do business with us, which is another reason why we actually partnered with CSG on the e-application tool, because we've taken our innovation with our quick real-time underwriting, put it on the CSG platform, so you no longer have to go to a quoting tool and then to another enrollment tool. You can do everything right from their portal. So a couple of things about our current Medicare supplement. Outside of the fact that I know you can't see my screen, we are in 37 states. That's all the way from Nevada, Utah, Arizona, Colorado, Texas, Oklahoma, Kansas, Nebraska, Iowa, which is our domicile state, Missouri, Arkansas, Louisiana, Wisconsin, Illinois, Indiana, Michigan, Kentucky, Tennessee, Mississippi, Alabama, Georgia, South Carolina, North Carolina, Virginia, West Virginia, and Pennsylvania. We are anticipating launching 4 new states this coming year on a charter. Those would be some very surprising states, I think, for some of you. So I'll just kind of give you a little teaser. We're looking at going into New Jersey, Maryland, Washington. We're going to flip into our new charter, which is in Utah. Even though we have product in Utah right now, it is our old charter, and we will end up moving that to the new charter. So what's different about the charter that we opened up in 2021? Well, the differences are we became very strong in the urban suburban areas. So historically, Medicare supplements are typically sold in the rural markets. A lot of my carrier competitors are still very strong in those rural areas, as they should be, but we did some market research to show where the populations were actually staying and getting their health care. And the populations, so think about snowbirds, right? My parents are snowbirds. They live in Indiana in the winter or in the summertime, and then they go to Florida for the wintertime. They're actually probably playing golf today in the villages. They are deciding to stay in their home in a suburb of Indianapolis. So they like to go to Florida during the winters. They've decided not to move. So the population that we are really targeting is that urban suburban areas, where the highly populated areas are of those 65 and over. So that's something that's a little different. So for those of you that may live in, let's say, Chicagoland area, we have really good rates in the Chicagoland area. Some of you may live in the Las Vegas area, Las Vegas and Southern Nevada, very good rates for the Medicare supplement in those particular areas. What I would suggest that you do is log on to the CSG quoting tool, run the most populous zip codes in the states that you represent, and you will be able to see that our rates are going to be very favorable in those areas. Something else that we did with our Med Supp charter for 2021 is we actually opened up 3 rate classes. So we have a preferred, a standard 1, and a standard 2. And the way I like to describe it is our preferred rate class are those seniors that might be more active than most. It doesn't mean that they can't sit on the couch and watch their favorite Jeopardy or eat steak and potatoes whenever they would like to, but they are a little bit more active. The clients that we are seeing being placed into our current block or the current charter that we're in are heavy on the preferred side. We have about 70% of our current blocks are on that preferred side. The standard 1 rating is for those that might not walk their dogs as often or be as active as often, or maybe they have a DX situation where they would actually not be considered preferred, but that DX may put them into the standard 1 class. And then your standard 2 classes are those for your tobacco users. So those that may be liking their cigars once a week or using a vape pen, those are super popular among the senior group now, or they are still cigarette smokers, that would fall into that standard 2. All rate classes can also be enrolled, quoted and enrolled on the CSG enrollment tool. So just to kind of give you an idea. You know, the nice part about Medicare supplements, especially Medico's Medicare supplements, is really the predictive costs. So the client is going to know exactly what is going to be covered under their Medicare supplement. The way I like to describe those that like to enroll in the Medicare supplement is they want to take control of their own healthcare plan instead of allowing the government to control their healthcare plan. So they have a predictive way of being able to stay in control of their own healthcare options. So some of the tools that I would say, if you could see my screen right now, it talks about the tools that you can be using to be able to sell a Medicare supplement. The first thing that I have on the screen right now actually says, don't follow a script. Every time you talk to a client, whether it's a client that you've had for a long time and you're going in to do a review and maybe looking at switching them from one healthcare plan to another, one Med Supp to another, or maybe going from an MA plan to a Medicare supplement, is listen to what they're telling you. Listen to what they say as far as how they want to control their healthcare. The zero premium is one thing, paying a premium and being able to control it, that might be the message. Therefore, you might need to talk to them about the Medicare supplement plans. And make sure you understand the needs by simply asking questions. Make them aware or ask them the question, are you even aware that a Medicare plan doesn't cover everything? Do you want to be able to control your own coverage? Talk to me about the coverage that you're coming from, whether that's from a group plan, from an employer side of things, or whether they've been on Medicare for you know, a period of time. What types of benefits do you want beyond your healthcare coverage? Are you looking for things for vision? Are you looking for hearing? Are you looking for dental? Are you looking for prescription drug coverage? Make sure you understand what it is that they are looking for. And then ask them if they want to be able to choose their own providers or if they want to just go to a network that's been assigned for them. You need to teach them the details. Teach them the details of their healthcare coverage as you're enrolling them so that they really can so they can actually get a good handle on what is being covered as soon as they receive their policy that would be issued. And then sell them the plan that meets their needs. If they're used to copays, maybe you put them in a G plan, even if they're MACRA eligible, you put them in a G plan or an N plan. Maybe that copay is not going to be as much of an issue for them to be able to keep their premiums down. Maybe they don't go to the doctor as much. Maybe they don't have the DX or the RX issues that would warrant them to not pay a copay. You just kind of have to really sell to their needs. Where would you find the information to be able to understand our Medico Med Supp plans? Well, you can do those for those of you that are contracted with us. You know that we have a wealth of information on our Medicare Information Center. That website is mic.gomedico.com. Your credentials get you into there and it shows you product information for all of our products that Medico has to offer, any incentives that we have, any business reports. So we have a daily dashboard. You can follow your applications through the process on the daily dashboard. You can see who might have lapsed their policies so that you can build a call list. You can also see where you stand actually inside of any of our incentive programs. This year, we added that capability for you to follow your own incentive payout. We also have what's called the My Medico app. That's a smartphone app that your clients can download. And I know some of you I could hear the eye roll happen. My clients are, seniors, they don't know how to use their smartphone. Technology has come into an age because of COVID with the senior population where they are more comfortable. They can download the My Medico app and receive their ID cards instantly on their My Medico app. They can follow their plan details. They can check on claim status for any of our products. They can find a provider. There's a one-touch call to the agent of record. They can actually receive any support from that My Medico app. The ID cards seem to be the most amazing functionality to our app, because as soon as your client is approved, which happens within moments of submitting the application, they can then go on to the My Medico app while you're still sitting with them or on the phone with them and be able to get a hold of their ID cards from there and visit their doctor immediately if that's what they need. So that is something that is new, and you can find that also on the Medico Information Center. The last thing I'd like to go over prior to giving it back to Anna to go through the enrollment tool is we do have a Medicare supplement incentive in market currently. You can see that incentive flyer out on the MIC portal, the Medico Information Center portal, but there is a minimum of 5 submitted Medicare supplement applications to be able to qualify for the quarter. Once those 5 have been have qualified, we're going to pay you back to the very first one. It's $125 for any underwritten Medico Med Supp application, and then $25 for any open enrollment or guarantee issue applications that are submitted. The last thing that I will mention is we have a partnership with VSP and Smart Hearing for all of our policy holders. So we do offer vision and hearing for our Medicare supplement plan policy holders, as well as any of our other product policy holders. So we do offer 2 different VSP options. One person or an extra person or the whole family can apply. And of course, you know that VSP has the largest number of providers that are out in market. Smart Hearing is actually free to your policy holders. There's a trial. It's actually free to the Medico policy holders, and it takes care of everything from office visits at an audiologist, batteries, warranty plans, and there's over 3,000 hearing professionals out in the market with the Smart Hearing coverage. And with that, Anna, I'm going to give it back to you.
All right, wonderful. Would you be able, I was just thinking, maybe I can have you email me those slides here during today's webinar, and then I can attach those slides to everybody through our sharing. I can upload a sharing. So if you want to send those over to me, that way we can get those slides over to everybody. I have the CSG quoting tool pulled up here for you, so you should all see my screen now. We did have a couple questions that came in regards to some of the items on Medico. We'll kind of save those questions because I will go through those questions here. We did have a question that did come in about the Medico My Enroller. That is still an option that is still available for you to use to submit applications. So if you would like to still use that, you absolutely can, but we are giving you another option here within CSG, so you can quote and do your enrollments right here on the CSG quoting platform. So a couple of different ways in which you would all have access to CSG. One is through your Integrity upline. They do provide you a branded quoting tool that you can use. So if you have access to their branded quoting tool, you can still continue to use that. The other option that you have here is through Medicare Center. So for those of you that have a Medicare Center account, you can access CSG on here. all you would have to do is in the upper right-hand corner where your name is at, you can go down to the CSG app, and that will take you into the Medicare Center branded CSG tool where you will see all of the products that you are available to quote and do enrollments for. I do have just my version of our e-application on here. I am on a test account, so I can submit these applications start to finish, but I do have the quoting tool here pulled up. So what I did is I just ran a Med Supp quote in my area for a 65-year-old Plan G. You will see when you run that quote for Medico, these different rating classes that Kelly talked about. So we have rating classes preferred, we have the rating class standard 1, and then we do have the rating class standard 2. So you will see those different rating classes on here. When you do the e-application, if you do the preferred and you hit apply now and they're actually a standard, based upon how you answer those health questions and what you enter in on the application, it would adjust the premium to the other rating class if that were to be the case. So it's very easy to submit your application on here. All you have to do is hit this apply now button. So when you're doing your quotes on CSG, any carriers that we have on our e-application platform, you will see the apply now button. In order to get into the application, you do have to be contracted. So every company will ask you for either your national producer number or your agent ID or writing number. So when you click apply now for Medico, it's going to ask you for your Medico agent ID, which is your Medico writing number. So enter that in. We will ping Medico's system in real time to validate that you have a contract. Once you enter that in one time, the system will automatically remember your agent ID, so you don't have to enter it in every single time. So you saw in this example that I just did, it didn't ask me for it because I've been into this Medico e-app several times already. The system will remember me. If you ever need to change your writing numbers in the system, there is a systems and tool icon. You can click on there where you can update any of your writing numbers or NPNs. So I'm going to make my screen just a little bit bigger here. I'm going to click on these 3 lines here. And then what you'll notice here is that quote automatically carries over for me on the right-hand side. I have my overview section where it has the quote, all of the initial documents. So if you need a copy of the outline of coverage, the disclosure, the guide, you can grab all of those documents here. And then as I go through the application and as I submit an underwriting type, the sections over here on the right-hand side would then populate for me. So if you're doing a fully underwritten, you're going to have health questions. If you do an open enrollment or a guarantee issue, you wouldn't. So that way we need to know first, what is your underwriting type? And then you also have your notifications. So your notifications is going to alert you of any errors in the application. So a great example, I'll show you a couple of these examples in a little bit, is your underwriting. If you answer yes to an automatic decline health question, the system is going to notify you of that decline, so you're not even able to submit the application. So any errors, if you select the wrong underwriting type, that's all going to show here underneath your notifications. As I mentioned, this is a universal app platform. So any carrier that you do an application on here, this is all going to have the same look and feel. All of the questions as you're going through, all of the required fields would be unique to Medico's paper application. So if you're used to submitting Medico business, you're going to see the same required fields, the same questions as you currently do on their system. There will be no difference there. So let's go through this application start to finish just to get you comfortable with all of the screens. Again, this is that first screen where it's going to pull in your agent ID. If this is a wrong agent ID or for whatever reason you need to change it, you can do that here in your systems icon. Underwriting type, I'm going to do open enrollment, and then you will enter in your plan eligibility and answer yes or no to the Part A and Part B coverage. Again, this system is going to alert you if you select the wrong underwriting type. So a common mistake from agents is being confused between a guarantee issue and an open enrollment situation. We do have this little eye icon here that does describe what an open enrollment or what a guarantee issue is. In some states with the birthday rule, those are considered open enrollment cases. If you have any questions or you run into an issue where you're not sure if it's an open enrollment or a guarantee issue, we will absolutely be able to help you with that. So answering those questions and then hitting continue. Once you hit continue, that's where your sections on the right-hand side would then populate for you that you have to go through and complete. What I really, really like about this platform is that you can hop around to different sections. So if you need to skip a section or come back to a section, you do not have to complete it in order. You can always come back. So don't worry about hitting the back button or the previous screen to go back. Just quickly navigate here by clicking on that section. Once a section is complete and good, it has that green check mark. A yellow air icon means that there's still information in that section that is missing that you will have to go through and complete. So as I start going through this application, your rate will update if you make any changes from the initial quote. So if you wanted to change it from a different plan type, you can do that here. You can see the plan F is grayed out because they're not eligible. So from here, we're just going to start by entering our first name, our last name, and Kelly, I'm going to use your first and last name as an example here. One thing I want to point out to you on the resident address, this is very important that you know that this is a feature on here. It has to be a valid address with the United States Postal Service. So if you misspell a street name, or if you have avenue instead of street, it will come back as being a submission failure. So make sure that you are actually using a street address and also the correct zip code associated with that. Otherwise, you will have a fail. So I'm going to enter in a street name here. Street address, city, state, zip carries over from that quote. Is the mailing address different from the resident address? I'm going to say no. Carries over a date of birth, the age, the gender, and then you can put that home phone number in there. If you are doing the text signature and you need to send it to the smartphone, you can put their cell phone number in here. Otherwise, in your signature section, you can change the phone number to a smartphone or a cell phone, I should say, if you did put their home phone number in here instead. And then your email address, you can just type in the client's email. I'm just going to type in my email as an example so I can show you the email signature option. So from there, you can go ahead and hit continue. As you hit continue, it is going to automatically save for you. So as you go from one section to the next, it saves. So what I, again, really, really like about this system is that as you're going through applications, you may get interrupted in the middle of the day. That happens. Or you need to come back to a section, or you're waiting for them to be available for your signature. All of your applications store within your e-applications panel. If you click on this view applications, and I'll show you this a little bit later on in the demo, but you can see all of your incomplete, all of your submitted, any applications that are pending signature, those all save for you in one location. So you can always come back in. Household discount premium. This is always a question that comes up in our quoting tool, whether or not they qualify for a household discount or not. So we have those definitions located right here. I initially quoted a no, so it has that non-household discount rate. If I would answer yes to this question and type in their spouse name, first name, last name, and I hit continue, the rate over here on the right-hand side is going to adjust to that household discount rate for you, so it automatically updates. So that is a safeguard for you. If you're quoting and you're not sure if they qualify or not, you can see that rate automatically updated there for me. Social Security number and Medicare claim number, those are optional in this case. I would recommend entering them if you have them, but they are not a required field. Any required fields have this red asterisk. So I'm going to answer yes to these particular questions as they pertain to the open enrollment, and then I'm going to hit that continue button. Again, you can hit continue, or you can just click on the section on the right-hand side. Once a section is complete, that's where you have all of those green check marks, and you can always come back into that section. Going on to the next section is the previous or existing coverage information. Depending on how your client would answer these, you can answer yes or no. You will notice if you answer yes, and if there is additional information needed, that's where you would be then prompt to enter in those additional details. If you have lost or are losing other health coverage, did you receive notice from that insurance company stating? You can write yes. If you answer no, that's where you would have that prompt for you as well. And then again, just hitting continue to move you on to the next section. The next section is the method of payment section. This is where we are only accepting one form of payment, which is the automatic bank withdrawal. Your quote over here on the right-hand side does reflect any type of automatic bank withdrawal discounts. So if I would select that, you do have different options for paying those. So you do have annually, semi-quarterly, or monthly. As you select those, you can also request the withdrawal date as well, whether that comes from a checking or a savings account, and then entering in either the bank's name or typing in the routing number. You're going to have different options populate here for you. And then the account number, and then the first name and last name. So we do not validate that banking information here. So if you have to make any changes to that banking information, you would have to contact Medico to make changes if you entered in an account number wrong, for example. We just can't store that banking information on our system to check. So if there is an error in the banking information, make sure you reach out to Medico. So last section here, this is your to be completed by producer section. You can answer those questions accordingly. You do have the option here, again, if you answered, however you answered the question, if there are additional prompts, those would populate here for you. No. Was there an interpreter? No. And then once I am all done, I can hit verify application. So verify application, this gives you one last opportunity to review the application start to finish. Again, it's going to go over every single section, and if you notice that there's any errors in a particular section as you're reviewing them, you can quickly edit that particular section, or you can hit the section over there on the right-hand side. So as I'm going through, you can see that edit section if I notice there were any errors in that particular section. So once I am done reviewing, I can go ahead and I can hit lock and e-sign. Again, this may be a portion of the process where you filled out the application. Now you're just waiting for your client to be available to do the electronic signature. That's where you can lock and e-sign, and then you can come into your view applications here. Again, I told you I would show you what this section looks like. It's very common. I talk to agents every single day that they sometimes they have to wait until their client's available to do the signature. So they start it. And now I have the status of locked. So locked just means that you have locked it. You can always unlock your applications if needed. But here's also an example where I have an incomplete app. This just means I started the application, but I have not finished it. Consented, again, you have some different statuses in here. What you need to look for is the submitted. So we're going to get there, but I did want to show you how you have different statuses and what that means. So locked, again, means you've locked it, but you can unlock it. Consented means they've consented to do the electronic signature, but you have not completed that electronic signature. And then incomplete is you started it, but you have not completed the entire application. So let's go ahead and get into this locked application. I'm just going to hit edit. It will ask me if I want to unlock it or not. I'm not going to unlock it because I don't need to go back and change anything in the application. So I'm going to continue to my e-sign here. And now we're going to go over the different signature options. As I mentioned, there are 3 different signature options. I'm going to go over 2 of them here within this. This is giving consent to do the electronic signature. So that's that one status that I showed you as consenting. You have to accept and then continue. Print would be if you wanted to print off the electronic disclosures and all the verbiage there. So here we get into our statement of signature. As I mentioned, you have those 3 options. If you are in the same physical location as the applicant, you have all 3 options: applicant providing identification information, email signature, or text. So in this first example, we're going to do the applicant provides identification information. You do this, you do have to open up all of these documents here. So we're going to open them up. It will open up in a new tab. Now we have the outline of coverage. Same with the disclosures. And then again, you have to open up every single document. Here is that guide, the application itself. We do go through Medico's paper application start to finish, automatically filling it out. I do want to show you that on here so you can see here everything was filled out accordingly, answering all the questions. So it is on their paper. Payment, I'm going to go through these a little bit quicker here. HIPAA, and then the receipt. So any other items that have to be added on, we'll add that on to that last receipt. After everything is green, that's where they will check mark, I have received, read, and kept a copy of the above documents. And then their signature is their mother's maiden name, and then the last 4 of their social security numbers. So you do have to type in those last 4 digits. They are acknowledging the city, the state, and the zip code that they're signing in. You would check mark apply e-signature. It will carry over your producer name and your agent ID, and then you will hit apply e-signature, and then you'll hit sign application. Close out of those while this then loads. It's going to say that it's going preparing and processing the application here. So you can see this preparing application. Once it has been submitted, it will say that it has been submitted. You will also have an option here to obtain another copy of those documents if you need to, so you have those. It's going to say, I'm of course on the testing portal, so it says testing portal, and it wasn't submitted, but I'm testing it, but you would have that same check mark, green box, yes, it has been submitted. So then when you go into your view applications, your status is going to say submitted. Now, in order to check the status of the application and whether or not it has been issued, you will have to check Medico's agent portal for that. But this status of submitted, this is what you want to see. This means that it has been submitted to Medico. You can always view a copy of the PDF, and then we also have a link to the mic.go Medico website for you to quickly sign in there. So that's one option. If you are not in the same physical location, I'm going to go ahead, I'm going to open up another application here that I've already filled out, and I'm going to show you the other option in this portion of the application. As that is loading here, I'm going to pull up an email that this is being sent to so we can see how that works. All right, so I have the agent ID carries over. Again, this is the same previous screen. This is just a different application. I'm going to go ahead and click continue to e-sign. And then again, this is the loading in the consent and the disclosures. I'm going to hit accept and then continue. And then in this case, I am not in the same physical location. So I have 2 options if I'm not in the same physical location. I have the email signature link, or I have the text signature. If you were to do that text signature and you enter in a home phone number here, you can edit this phone number and change it to their cell phone number in order to do the signature. If you needed to change the email, you would have to go in and edit the application and change the email in the applicant information section. Carries over your producer name, your agent ID. You will check mark apply e-signature, and then you, the agent, is now signing the application. So your status is going to say applicant pending signature. So it's not done yet. We do have to still have the applicant sign it, but you, the agent, has now signed it. So this says this application is now pending the applicant's signature. You have the option to review those forms. I'm going to click on view applications here. And then as I do, and this is a common question that I get from a lot of agents, is what this next status says. So I am going to explain this. That way you know what this status means here. So your status says producer signed. So this means you, the producer, you signed it, but the applicant has not signed it yet. Again, it has to say submitted if both parties did sign it. So it says producer signed. You do have an option to resend the signature to the individual. They have a 2-hour window to sign it. That's very important to note, a 2-hour window to sign it via text or via email. So that's where a lot of agents will go through the application, they'll fill it out, they'll wait for their client to be available, then they'll get into the application. So again, if it's past the 2-hour window and they open up their email, their link and their verification code is not going to work. That way you need to resend that. So we have a quick link for them to resend that here. So I'm going to go ahead and open up my email to show you what this email looks like. All right. So here is the email. It's going to say your agent. It's going to come from a do not reply at CSG. You, the writing agent, is going to be copied in on this email so you can verify with them that it has been sent. And if they have any questions, you can at least answer that. So you're copied in on that email. And then it will have this verify signature and then their code. So they can copy that code. Again, it says this code will expire in 2 hours. So they're going to click verify signature. They're going to enter in their code, and then they do have to enter in their date of birth. If they entered in an incorrect date of birth here that does not match the date of birth on the application, it will not allow them to verify. So if they're saying, I entered in the code, I entered in my date of birth, it's not letting me verify, that's because you have their date of birth wrong on the application. So if that's the case, you can go in and you can edit that application, but you will resend them a new code. So this is agreeing to the terms and the conditions of the signature. We'll go ahead and we'll hit I agree. So there's 3 screens that your client will do. One is the verify. The second is the agreeing to do the electronic signature. And then the third is the actual signature. So the actual signature, just like they were in person, they'll open up every single document. So they'll open up the outline, the disclosures, all the bars will turn green. Again, I'm going through these really quickly just for time purposes, but you saw them on that previous screen. Once they've opened them all up, they're green, then they can check mark, I have received and read a copy. If they're not able, if they're saying, I can't check mark this, ask them, were all your bars green here? That's what they need to do. They need to open up all of them. And then their signature is acknowledging the city and the state that they're signing in. If you didn't notice, I'm using lots of Omaha, Nebraska zip codes. That's where I'm located. Omaha, Nebraska zip code. And then I can go ahead and hit apply e-signature and then sign application. So again, 3 steps if they're doing it via text or via email. It's the same screens. It's just they're doing it on their smartphone instead of through their email and their computer. They can also open up their email on their smartphone as well. And then it's going to say preparing application, and then it will say that thank you for submitting your application to Medico. Once they get that notice, they can print those documents as well. And then if you come in here and you refresh your page here, you will then see the status has changed to submitted here as soon as this is done loading. So it's been submitted. Quick, easy. So we just did 2 applications pretty quickly here, going through those. One last thing I want to show you here, I'm going to open up one other application that I started. I do want to show you what the underwriting looks like on here as well. So this, I started an underwritten application. That means I have the general health information and then the medical health information. So this is where if you answer to the fully underwritten, you're going to have additional sections that you have to go through and complete. Also, the physician information populates. So some of the criteria here is entering the height and weight, entering that in here, the tobacco question, whether they use tobacco or not, and then going through the health questions. If they answer yes to an automatic decline health question, that's where you'll see your notifications here that the applicant will not be issued coverage because you answered yes to at least one health question. So that's where you're going to see that automatically, that status of being denied. So if you want to go through and figure out whether or not it's going to, pass that first phase of underwriting just by answering the questions on the application, this is where you'd go through here pretty quickly and answering that yes or that no. You can do the same on the medical health information. This is going to ask you about those prescription drugs, if they're taking any medications. Same goes with this. We will alert you if that particular drug would cause an automatic decline here. So you can enter those in here. After you enter them in, you would hit add RX drug. It adds it for you. Then you can start typing in your next drug. And then again, you have that physician information as well that you can enter that information in this section. So 3 additional sections there. Again, that's why we do ask you for your underwriting type ahead of time, so we know which sections to populate for you. And then all of those automatic declines will come over in your notifications here. Again, your rate would adjust for you based upon how you answer health questions, the height and weight, the tobacco questions, the household discount. That way you can quote them accurately as well if you're not sure if they're preferred or standard 2. All right, that's the EAP. What do you guys think? Nice, easy to use? I hope so. I hope so. I'm going to get to some questions here. Opening my questions tab. Kelly, by chance, did you email over to me those slides?
I did.
Did you have an opportunity to? Okay, perfect. I'm going to pause my screen here for 1 second, everybody. And then let me just open up my email so I can get that attached to here. But we are still here with you. All right, I'm going to save this attachment. Let's go, oops. See if I can quickly move this over to my sharing. Handouts. Bear with me, everybody. Almost there. If you have any questions, go ahead, type those questions into the questions chat, and we will start answering them. When I do these webinars, I have so many. Okay, choose a file. See if we can get this quickly here. It is uploading here for you all. So look in your handout section, everybody. This is where we have Medico's, it's a PDF of the slides that Kelly was talking through. So go ahead, grab that from the handout section. A couple of things I do want to kind of point out to everybody that we were recording this, so if you have to go back and rewatch it, you absolutely can. Since I do have the that handouts, I'm also going to send you guys over one other thing that I think will be beneficial for you all, and that is a PDF outline of all of the slides that I went over today as well. I think that's going to be really helpful too, so I'm going to drag that into the handout section. So you also have a link to that PDF tutorial. Again, we do have a YouTube video out there too that goes through this application start to finish. Maybe I will chat that over to everybody as well as we start to get to answer some questions. Kelly, I'm going to refer to some of these first questions for you. Okay. Earlier you mentioned an DX.
Oh, yes.
Can you go over what the DX means, please?
So DX is diagnosis codes. Perfect. So RX is drugs, right? We're used to RX, but DX is just short for diagnosis codes. So people that might have a pre-existing condition.
Perfect. Cindy, your question is the T65 or new Part B tobacco user given a preferred rating class. Go ahead,
There are
Kelly.
there's 3 states that do ask the tobacco question for OE: Colorado, Kansas, and Missouri.
And then Nicole has a question about the smart hearing. Is this free to every Medico policyholder?
Yes, so all of our policyholders, regardless of product type, have access to VSP and smart hearing.
Let's see here. Susan, you said, how do we get on the CSG quoting tool? What I would recommend doing is, one, we can look you up in our system to see if you already have access through your Integrity upline. A lot of them offer a branded CSG quoting tool. If you have access through Medicare Center, you can also access CSG on Medicare Center. I'll show everybody that too, because many of you should have access to Medicare Center. I have that here pulled up on my screen. So if you hover over your name in the right-hand corner, you will see that CSG app. Just click on CSG app here, and then it will say loading. It's just gonna make sure that it's gonna connect you right into CSG. If it does not connect you in, just make sure that you don't have any pop-up blockers, because it does open up this new tab or this new window right here. And then you have access to all of CSG's suite of tools. So I did have a question that came in about the other products that CSG can quote. Oops, I'm working off one screen here, so I apologize for that. We quote Medicare Advantage, the Part D. We also quote the hospital indemnity, the senior dental, the final expense. We do have Medico's ancillary products on our quoting tool to be able to quote. So if you do need Medicare Advantage and you want to fill the gaps with that hospital indemnity, we do have Medico's hospital indemnity. We have Medico's dental as well, and then your sister company, Great Western's final expense. So we do have all the Medico products on our system for you to quote. The only product that you can do the enrollment for right now is the Medicare supplements.
She said something very pivotal, and she said right now. So
right now.
It's coming soon.
Our goal is to have every product, every carrier on the e-application for you. So I know right after we were done working on the Med Supps, I know we're going to start working on Medico's ancillary. So we're very excited about that. All right, let's see. We have so many great questions. Arthur, you have a question. Can we still use My Enroller? Yes, you absolutely can. This is just another avenue for you if you would like to take that. Kelly, question for you. I think I could answer this, but I'm going to give this over to you. Rachel is asking, is there a way to access the declinable drug list from the application?
The declinable drug list is actually listed on the Medico Information Center on the underwriting guide. So you would go to mic.gomedico.com, go into your product tab, into the Medicare supplement tab, and then all the way down at the bottom, it'll say new Medicare supplement underwriting guide, and that's for the new charter. And the declinable drug list is in there.
Perfect. Oh, I love this question. Rory, your question is, does signing with CSG conflict with my FMO? Absolutely not. So your FMO is providing you these tools to use for free. And any applications that you submit on CSG, all of your commissions are paid the same. We don't touch anything. All of that is if just like you were submitting an application directly through Medico. So, so if you want to ever individually purchase our software, you can absolutely do that. Otherwise, you can always use our access free of charge through your Integrity upline or through Medicare Center. Any applications that you submit on CSG, all your commissions are paid the exact same way. CSG, we are not an upline, we are not an FMO, you do not get contracted with us. We are here to provide you the tools to be able to quote all of your products in one location. So great question there. Lots of questions about just being the same question. So when you're doing an application on CSG, it's going to be the same questions that you would see on My Enroller, the same questions that you would see on the paper application. You're just giving a new electronic way to submit it on our quoting tool system and kind of our look and feel to our e-app. For a Medicare card number. So Gina, you asked how soon before a Medicare card is issued can we submit the Med Supp app? Right now for the, it's on a requirement on the application. So if you want to submit it, if they don't have their card yet, you can still submit it on our system. That's on a required field on the application. I think I showed through that. Let's see, I'm not sure this question, so Kelly, I'm going to refer this over to you.
Okay.
Can you have a policy go into effect on the 1st of the month, but have the draft date be set for the 15th?
Yes. The only draft dates that you cannot choose are 28, 29, 30, and 31.
Jeff, for the banking information, you do have to capture it with your from your client. There's not a space in the application if they were signing electronically for them to open it up. So you, the agent, does have to fill it out. If you were face to face with them, you can absolutely, move your computer around or have them come behind your computer for them to enter in their own banking information. But when you do the signature, the only option on the signature is for them to review the documents and sign it. Ernest, your question, will the system adjust to a better rate if they qualify? Absolutely, yes. I kind of went through that on the system. The application is a smart app, so it's going to alert you based upon what you enter in the application versus what we quote. We spend a lot of time working with Medico to make that feature available to the agents, so you have the best experience possible using the e-application. Again, in order to check whether the status has been issued, it's been declined, that's something that you would have to check on Medico's agent portal. Kelly, we have some questions coming in about the preferred, the standard 1, the standard 2. Can you kind of repeat in the very beginning the differences between those different rating classes?
Sure. So first and foremost, your standard 2 is probably the most straightforward. That's your tobacco users. Let's just call them your tobacco users because they're going to have the most RX, DX, and they're all going to be tobacco users, right? Most of them. So then the preferred one, the preferred is for a healthier class. So let's, and it's outlined too in the underwriting guide. There is less RX and DX. So prescription drugs are at a minimum. The pre-existing conditions are at a minimum. That would be your preferred. So remember, I said most of our policyholders currently, about 70% of them fall into that preferred category. Standard 1 is roughly about 20%, and then 10% fall into that standard 2 class. That standard 1 is those that might not necessarily be as healthy, may have some underlying pre-existing conditions that are not knockouts, maybe take some drugs that are, maybe it's metformin, which is not a declinable drug at this point, but it's going to be your lesser healthy people, but would still pass underwriting.
Awesome. I did pull up Kelly's presentation here because we had some questions on the availability. So I pulled up that state availability map, but why don't you talk about the exciting incentives? I know we're right up on time here, but I want to give you an opportunity. There's some amazing incentive programs that you currently have going on right now for agents. Yeah,
so the current Med Supp incentive is 5 applications to qualify, and those can be any applications in the OEGI or underwritten. It just takes 5 to be submitted, and then they qualify. Those applications are then paid back to the very first one. So any underwritten application is paid at $125 up and above your commission. And then any open enrollment or guarantee issue application that is submitted and then approved goes into the system as $25 for incentive. It's unlimited earning on our incentive between January 1st and the end of March. We also have, just to kind of piggyback on that, we do have an ancillary incentive that's in market as well. You can find that information out on the Medico Information Center. It's a great cross-selling incentive. So, with a healthcare policy, if they go Med Supp, it's great to add on the dental or the cancer plan. We're going to pay you for those as well.
Perfect. All right, I'm gonna pull up one last screen here. If you need, or if you have any questions about Medico, I have the phone number pulled up, their agent website as well. I know we are right up on time here. If we did not get to your questions and you still need your questions answered, please feel free to send myself, call Medico if you have any questions as well about anything on the application, or if you need access to anything, you can always go to that mic.gomedico website to obtain that. Again, we're here to help you as well. So if you have any questions as you're going through an application and you need assistance with that, I'm going to pull up the CSG website really quickly here for you all. Our phone number and our email is listed on here. So it's 855-861-8776. So we're here Monday through Friday, 8 to 5 p.m. Central Time. So if you're going through an application and you have questions, call us. We're here to help you. If it's over the weekend or in the evening and you're going through an application, send us an email. We're really dedicated to our agents. I'm kind of guilty of it. I will check through a couple of emails in the evening just to make sure that our agents are taken care of who are using our platform. So if it's over the weekend, send us an email. Hopefully we can help you too if we can. So I appreciate everybody's time here today. I know the hour that you spend with us is an hour that you're not writing a Medico Med Supp. So I appreciate you being here. I look forward to seeing you submitting applications on our system. And again, we're here to help you be successful. So let us know how we can help you. If your questions were not answered, I apologize, but send us an email and we will be happy to help you out. So thank you, Kelly, again for your time. I know you are busy, so I appreciate you jumping on here with us as well.
Thank you.
All right, bye-bye, everybody.